Okay, John, hi.
Hey, how are you, Dr. Daitch?
Good. So we've known each other for some 9 or 10 years.
Correct.
And you have presented me originally with some back and leg symptoms.
Yep.
And we've been treating it over the years. We started with some epidurals, and then we did radio frequency, and then things really started worsening in 2021, and you were getting more and more symptoms of spinal stenosis and difficulty walking.
Correct.
And we had done a mild procedure, which was somewhat helpful, but not good enough.
Right.
And then we even put a spacer in, a Vertiflex spacer in there. We
Correct.
did that, a little over 2 years ago.
Correct.
And that was good for a while, but that started slipping and getting out of position.
Yes, it did.
And one of your problems at L4-5, one of the vertebrae was slipping forward and moving,
Right.
and that caused the spacer to slip out of place. And then you started getting more leg pain back.
Correct.
So when I saw you about 3 months ago, you were not doing well at all.
That's right. I had reached a point of not really even being able to walk to the mailbox.
You were so weak. Your legs were, you were afraid that they weren't even going to hold you.
That's correct. I mean, I had a hard time standing for anything longer
Even more
than
than
minutes.
minutes. You couldn't even walk for hardly a minute.
I couldn't, I was a walker. And
Yeah, you
I was very used to walking a few miles a day.
Right.
And I got to the point I couldn't walk to my mailbox.
Right. So
it was dramatic.
You were in a crisis, and you were getting weaker and weaker, and just moving in the wrong direction.
That's correct.
And I told you I had a newer treatment I was doing.
Yep.
Called Inspan, and it's a very strong device that puts in that. I told you I was going to take the Vertiflex spacer out, and I was going to put this more robust device in here. It was going to lift up the vertebrae, create room. The nerves were pinched coming out the sides, and I also told you that it was going to, because of the slip, it was going to fixate that segment so that it really can't slip anymore. And so you're having a lot of back pain, a lot of leg symptoms, and so we did about 6 weeks ago.
And I'll tell you, I have to tell you, one of my major concerns was the spondylothosis or whatever, with the slippage of the vertebrae. That's something that starts to
progress, right?
It can only get worse.
And we were catching it at a good time.
Yes, sir. That's absolutely right.
So tell me, you said now you're able to walk over a mile.
I'm able to walk 1.2 miles.
And you couldn't even walk to the mailbox.
I couldn't even walk to the mailbox.
And your legs were not feeling strong.
That's correct. And that was 6 weeks ago.
6 weeks ago, right.
That was 6 weeks ago, and yesterday I walked about 1.25 miles. I suspect I'll be back to...
and you can only stand a minute, and now you can stand 10 minutes or
I can
longer.
stand 10 minutes.
And we haven't even started physical therapy yet. By the time we start physical therapy, he's going to be back to his old walking self and strong and vigorous. And you've really got you've gotten your life back. Basically.
That's just what I was going to tell you. Yeah, it's distressing when you're in your mid-60s,
right? And
all of a sudden your life stops. And when that happens, fortunately, I had known you for 9 years.
Right.
And that I had been seeing you, and so when we talked about the newly invented or new procedures, I was ecstatic. Minimally invasive.
And I brought all the latest to you through the years,
yes,
and as
as
technology has improved, and but we've gotten to the point now where we really have this thing, much more fixed than we ever did. I think we were putting some band-aids in and improving things, but not causing a real big structural change and improvement. But I think we're at that point now. So I think things are going to be better and better. You're going to get stronger and stronger. So.
Yeah, I would agree with you. My improvement's been, in my humble opinion, nothing short of remarkable. When you go from being debilitated, you can't stand for longer than a few seconds, you can't walk to your mailbox. That's distressing. Anxiety ridden. I mean, it does all kinds of things to you, and so those are the things that it helps.
Loss of worrying about your future.
Sure.
And where am I going to be I'm gonna end up in a wheelchair, you know, so absolutely.
Yeah, I mean,
So-
I have gone through all of the mental gyrations that probably most of your patients go through.
Right, yeah, because everybody's questioning and doubting, and, you know,
Sure.
is this really the answer? But I think this is a fantastic answer.
Yeah, well, I tell you what, I'm thrilled, and I just can't wait to continue to
Progress.
get better with the PT.
To progress, that's right.
And get better by continuing to see you, so.
Well, thank you for allowing me to do that for you, and it's
Thank
gonna
you.
be fantastic for your future.
Thank you, Dr. Daitch, I genuinely appreciate that.
My pleasure.